Today's episode of the Gestalt Education Show is brought to you by three of our favorite sponsors: Human Locomotion, Core 360 Belt, and Dynamic Disc Designs. All the information can be found below. By now, you have definitely heard us talk about them, so check out the show notes, click the links, use the codes, and make sure you support our favorite people. As always, we got a great episode lined up for you today, and thanks for tuning in. All right, everyone, welcome to another episode of the Gestalt Education Podcast. Today we are in Tampa, Florida. We have been indulging in a DNS baseball course for a private team to be named later, which has been a lot of fun. And we have had the pleasure of having our favorite New Yorker, Dr. Robert Minlionica. Rob, this has been a long time coming, buddy. You've actually been a big influence on me, because when you were an intern, it was kind of right when I first started my little deep dive into sports medicine and into working sideline work and stuff like that. And so you were a great resource for me. You left me with one of my favorite intern gifts of all time, which is my pack that I use to work sidelines and stuff like that. So anyway, Rob, obviously you've been an intern for us. You've been a student for Brett for a long time and for myself, and we're excited to be here with you today, number one. But number two, people may not know your past, and that you kind of cut your teeth with professional football. And so not only are you a Chiro ETC, but you kind of reached the top of the level when it came to athletic trainers. And so I kind of wanted to start off with just a little story on maybe the lessons you learned from that, and then what kind of drove you to chiropractic. And then we're going to get into the other real big things, which we kind of want to talk about today, which is you decided to open up your own practice. And so obviously that's a huge step, and we want to dive into that a little bit longer. But maybe just talk about kind of the lessons you learned when you were with the Jets, and kind of what it was like with the NFL.
So before chiropractic school, I worked as an athletic trainer and was 100% full in on that. Had no plans of kind of branching out after that. But as an athletic trainer, you're doing a lot of things in the world of medicine that, as a chiropractor you don't do, or as a physical therapist you don't do, the things that people don't see. And it's a grind. You're seeing patients on the field and then transitioning them all the way back to return to play. And you're dealing with high stress situations. You're dealing with, crazy personalities in the world of athletics. And it's hell of a rush. Mm-hmm. So, during my time with the Jets, we were spending boatloads of time with athletes, traveling, early mornings, late nights. And then during the end of my time there, we were, trying to figure out what was next. And Dr. Jason Levy, he's the current chiropractor for the Jets. He kind of just said, "Hey, why don't you go apply to chiropractic school?" And I was like, I haven't taken a meaningful class in about 6 years, but why the hell not? I applied not to Logan. I was actually enrolled at Parker.
Oh, wow. Okay.
Yeah, I was enrolled at Parker. And then we had another chiropractor who did some work with the Jets. He was like, "Hey, why don't you try out Logan?" And then I know at the time Logan had some relationships with the University of Mizzou and Memphis. And I said, "Hey, if I can, still work in the world of athletics, but kind of take my scope of practice a little bit further, why the hell not?" And then kind of just took that leap of faith.
That you could be working with the Harvard of the Midwest Mizzou that kind of turned them?
Yeah, I guess that could have been it.
How that would have happened.
Yeah.
Classic Brett, just trying to interject. But then, so Rob, obviously you went through chiropractic school, and you were heavily involved in seminars and things like that, which is kind of how we got hooked up. But then, so you did your first internship with us, and then you progressed to Memphis with Jude.
Yeah.
And so, can you kind of talk through that process? We had a good conversation earlier this week about what you learned from each of those internships. I thought it was really interesting. So can you kind of walk through what that internship process looked like?
Yeah, when I was at Logan, I was with you guys for a bit. I was with Back Pain Center for a bit, and with you guys, I wasn't a rep for any club, so I was kind of coming in having to almost prove myself as an equal or someone who is worthy of that position, because it's a very coveted office. You know, a lot of people want to be involved there. And one of the biggest things that we kind of honed in on was, you know, the world of customer service and kind of treating the patient like you actually give a shit.
Yeah.
You know, like you actually want them to do better. You want them to live a healthier life. You care about their case, and how you treat the patient when no one's watching is kind of how you gain your trust. So I had a phenomenal relationship with you guys. Really took me in and gave me opportunity to grow and be introduced, you know, to DNS, something that I had no idea about through my whole career of athletic training. And that kind of took me to Memphis. And Dr. Jude Miller was awesome at facilitating, you know, good education when it came to athletics. You know, we were working in the training room. So I felt back at home working with athletes when they were, you know, pre-practice, pre-game, injury on the field, right into the training room. During the games, it was kind of a full circle moment, because I was back in an athletic environment, working at a high level and contributing, like being an actual part of the team.
Yeah, it's amazing. And I think that's sometimes that's a little bit difficult of a situation for chiros to be in. And with your background, obviously in athletic training, that was the simple thing. But then maybe what were some of the skills that you felt like, number one, made you successful as a trainer, but then transferred over to the chiro world?
In the world of athletic training, you're dealing with a lot of acute care. Like shit hits the fan and you have to react. Yeah. You don't have time to think. You have to make sure you're doing the right thing at the right time. You know, getting the correct people involved on the medical team. So, and as a chiropractor, you're not necessarily seeing acute care.
Yeah.
Minutes, seconds after it's happening. So the ability to keep even keel and kind of keep your composure and make correct decisions without making any brash decisions is something that I think helped me. Yeah. But in addition to that, it's everyone wants to have like a busy office, have, you know, their hand in a lot of different things, but the multitasking of having to work yourself around a training room helped me kind of work around being a chiropractor. And kind of tying in the world of sports medicine of, you know, having to be involved with different patients at the same time.
Yeah.
A lot of people. Oh, sorry.
No, go ahead. I was just saying it's a difficult world to live in, you know, like the acute care world, because a lot of things there's a lot of unknown with that, you know, like in that. I think that's a difficult thing with athletic training. You know, we're talking with the staff this weekend, which is mainly ATCs, and sometimes you just have to take leaps of faith when it comes to your treatment and your assessment and things like that. And so I think that's something that I actually learned from you a little bit too, just talking to you through your experience with the Jets and other things like that. Is like sometimes you don't 100% know, but you have an inkling. Therefore, you kind of choose your decisions wisely from there. And I think that's something that it's difficult to instill if you haven't been in the trenches and you haven't seen those crazy cases. You haven't seen the dislocated shoulders, the broken collarbones, the torn ACLs, the concussions, like little things like that throughout the whole time. Like until you see it, you know, you can educate as much as you want. You can take online courses, you can do all that good stuff, but until you see it firsthand, there's really nothing else like it.
I think one of the most important things, it's kind of separate. Like one is almost like clinical acumen of managing cases, and then almost like DNS, where you may not know exactly what we talk about today, like where do I start? Mm-hmm. It's having a place to start that is not harmful for the athlete. So whether, you know, someone goes down with like a potential concussion or a neck injury, it's like, what am I going to do for this athlete to make sure they're safe and they're getting to the right place? But also in rehab, like you need a place to start. So in athletic training and chiropractic, you develop a location that's safe for the athlete, a place to start that you can branch off of, whether it's triage, where do I have to go next, or what exercise do I pick next?
Yeah, it's true. It's very true.
I mean, we get a lot of questions like with the high school students, like what would be a great like pathway, like education wise, like what do you do for undergrad, things like that. So you're really unique. You've set yourself up to be an ATC in your undergrad education. Then you went on to chiropractic school. You've said multiple times this week as we've been hanging out that you wouldn't change a single thing in your career trajectory. So to people out there that are like making recommendations, would you recommend going through an ATC program as your college education, your
undergrad, your
and then on
like that?
Was that?
So when I was getting my bachelor's, there was a bachelor's in athletic training. Now you can't. Now it's a master's degree. So you're getting students who got their bachelor's in really mainly anything health related, and then they have to get their 2 years of master's degree to get the athletic training license and to pass your test. But if you do want to work in the world of sports, I think there's nothing more valuable than being in the trenches, being on the sideline, being in the training room, doing the less than desired things. Like, the world of athletics is sexy, but there's a lot that you learn about yourself as a person, as a clinician, when you have to do things that maybe as a chiropractor you don't necessarily want to do. You know, the pre-practice setup, breakdown, rushing out of practice to get treatment in, cleaning tubs. Like, these are things that allow you to prioritize your day for one goal. And in the world of athletics, that goal is, to win a championship, to win a, to win a playoff game, to get to a certain point. In the world of chiropractic, you could take those experiences and it allows you to kind of manage real well.
What were the main differences between like a Division I program, which you were plugged in with Jude there at University of Memphis, versus the New York Jets? Like, what were the differences you noticed?
Obviously the massive amounts of work that needs to be done. So at Memphis, we were essentially full-time chiropractors for most of the athletic department. So we were kind of hubbed in the football training room. Athletes would come and go. We did work games for football specifically. But in the NFL, there's things that you do that you don't have to do in college, like combine prep. Athletes come in for tryouts. You have to work the tryouts. You're helping the physicians with their physicals, with their dictations. Like, there's so many things that have to get done that you don't even think about in a professional organization. But in the world of athletic training, there's more of you than there are usually the physicians. So you're really boots on the ground, taking care of day-to-day things, which allows you to multitask. And there was definitely a lot more responsibilities in the team environment in professional sports than at Memphis, because we were really an adjunct at Memphis. As an athletic trainer, you are the first line of defense.
Right. Well, and I think that I'm going to put words in your mouth, but I'm guessing that multitasking is really transferred over to what your role is right now in your associateship, in which we can kind of talk about as far as what your role is with an associate, and then what's kind of driven you to open up your own practice. But the multitasking, I think, and Brett and I talk about this a lot, there's so many things in your day as a chiropractor that you're dealing with: text messages from patients, and new patient exams, and staff issues and things like that. That multitasking is what I really believe is what makes a really good clinician, because you have so many things that are getting pulled. You're getting pulled in 15 different directions. Things are getting shoved on your plate and things like that. And so I'm guessing that multitasking is really transferred over to the chiro ops.
Yeah. I mean, you think you graduate, you just treat patients, but then you get into practice and you're like, okay, now I have to take care of all these cases. I need to interpret radiology. I need to have that hard conversation with a patient that you potentially find something sinister. You need to get authorizations. You need to do peer-to-peers. Like, there's so many other things that encompass the world of healthcare, rather than you just having a patient on the table, getting a good diagnosis and treatment.
That's the easy part.
And I don't think I'm trying to think of another discipline versus ATC where, like, I feel like in professional sports, like 20 years ago, it was about taping ankles and things like that, tying gloves. But like now, these ATCs, they're like expected to perform at like a very high level. Like, you would kind of expect like a physical therapist or even like a chiro or whoever's like delivering this rehab treatment. So you got to know all the old stuff, but then like there's a lot of new pressures on the present day ATC to almost like understand all these different things. It's kind of been a really interesting trend in the last 10 years in that department, I think.
Yeah, I would say that I would put up any of the best athletic trainers up against any of the best chiropractors or physical therapists. We have that physician title, that doctor title, but that doesn't mean that athletic trainer can't school us in the world of assessment and rehab. It's just, I guess there's been a bit of a shift in the world of athletic training education, that they're moving to the masters, but there's some sick athletic trainers out there who get great results.
Unbelievable.
And they really have a good buy-in with the patient, because as an athletic trainer, you're with your students or your athletes every day.
Yeah.
We're seeing
for multiple hours, like sometimes
we're doing 6 treatments a day.
Mm-hmm.
As a chiropractor, you may be seeing 2, maybe 3 sessions a week with one patient, but to see the matriculation of a case when you're seeing them every day for, months at a time, you see the ebbs and flows of a season, and like how the body recovers and how they respond to injury, and what they like, what they don't like, what makes them feel that they could perform their best on Sunday.
Yeah, and I think that's a difficult thing. To your point, there is sometimes what makes them feel the best isn't always what's the best treatment for them. And we kind of exposed that a little bit this weekend with DNS baseball. Is like sometimes you got to do things to those athletes that make them feel good, that maybe isn't pushing towards the ultimate goal of changing function, which is, you kind of talked about that today.
There's lyrics in a Coldplay song that says, sometimes you get what you want, but you don't get what you need.
Yeah.
And I think that describes it so perfectly. And especially at that world, people think they know what they need, but it's not, or what they want, but it's not actually what they need. And I think being able to play in that world and struggle with your verbiage and trying to, meet them where they're at, and be able to be able to plug that in for them, because at that level, I mean, these athletes, they think they know and they think they can manage their case well. And honestly, they just can't, because they're just too ingrained in their own case to understand what they actually need.
And so maybe that's a question for you, Rob, is how do you balance that? Where is the fine line between those?
I think in the world of athletic training, you're spending almost more time with these athletes than you are with your family. So yes, you do have a professional relationship, but you do develop a different level of therapeutic alliance where you understand the patient or the athlete. This is what they like pregame. This is what they like post practice. But if you can build good enough a relationship, you can continue to trickle in those little things that you believe are going to change function for the better, are going to give them, more longevity in their season or in their whole career. But at the same time, you want your athlete to perform their best. And if they need XYZ, who am I to tell them that that's not right for them?
Well, and I mean, whether they will admit this or not, they're Ferraris. A lot of times in general practice, we're dealing with Ford Escorts. There's nothing wrong with a Ford Escort, because it gets you from point A to point B. But you have an opportunity to deliver care at such a high level, because you're with them so much, as you were saying, and you're with them with the same people over consecutive days. So you can just take this model and you can just deliver it at such a high level that it almost keeps you up at night when you think about what's possible for it.
100% keeps you up at night. I mean, you lose sleep. We could have done this, we could have done that, but at the end of the day, you have a different goal in the world of athletic training, in the world of sports. This is one thing that, as a chiropractor, if I didn't do the athletic training route, I would probably not understand how much I missed. But as a chiropractor, what I miss is being a part of a team and having a common goal. So you're working towards something specific. You need to do everything in your power to get to that point. Whether it's high school, college, in the professional world, everything that you do is selfless. It's what can I do for the team? What can I do for this athlete for them to perform their best at whatever sport they're doing?
Well, even I feel with the professional teams, the chiropractors oftentimes get typecasted into just being the person who's in the corner, who's doing an adjustment. And of course, we know we're so much more than that. So how do you work on kind of conveying the message of what the present day contemporary chiropractor could potentially offer a professional team that's honestly quite above just like banging joints?
So in professional athletics, like everybody has a role. Like you may be a savant at DNS, but they may have 5 athletic trainers who are there to do rehab all day, but they can't manipulate. So your role is to manipulate. That doesn't make you less of a clinician because you're not utilizing all these different techniques. Your role is one specific thing. You do that real well. You fit into the team. You have to trust your other healthcare team to take care of the things that you may want to do. But if you have good communication, there's no reason why every component of a patient case can't get taken care of. I think so. Right now, I work with a high school. I'm a hybrid athletic trainer chiropractor, so I'm kind of doing everything from like tape to covering games to treating them the day after the game. I think we can provide so much, but at different levels of athletics, you need to know your role. Mm-hmm. And I think if you know your role, you can gain trust with the other team members. Like, I'm not trying to step on your toes, but you just have good dialogue. This is what I think the patient needs. How can we get them there?
So the term that's often used is stay in your lane. So maybe stay in your lane early on, and then as you're gaining rapport with the staff, then you kind of get more power to be able to maybe implement more.
Yeah, I mean, in the high school that I work with now, it's pretty much everything. Kid gets hurt, you had the discussion with the coach. This is what they need from an imaging standpoint. This is what they need from a treatment standpoint. This is how we're going to prepare them to play on Saturday. It's different at every level, but if you are hired for a specific thing and you do really well at that, you gain the trust to branch out.
Mm-hmm. Yeah. I mean, that's the same story that I have with the high school with us, our athletic trainer, Brandon. I mean, for the first year, I literally just sat there and watched. Like, I literally just shadowed for an entire year. Didn't work on a single case almost. But then, like, slowly but surely, I gained his trust. I let him know I'm not here to take your job. I'm not here to do anything that you're not. I'm just here to be a resource. And then once you get that rapport that you're just a resource for that team, then you can start branching out. But at the same time, like ATCs and Kairos, we kind of have similar lanes, if you will, like if you have the skills. And so I think that once there's trust, that there's not like, hey, I'm not here to do anything that you're not going to be, then there's a better working relationship. But too many times I think Kairos just jump in and like, oh, I'm here to change everything. Like, I'm gonna change the entire world. We're gonna do all this stuff, and that's not the right approach. Like, you got to slow burn it into building trust, which then kind of evolves into a good relationship.
I think the biggest word used there was resource. Like, you're going to the high school every week. You could potentially have an athlete get hurt and treat them every damn day, whether it's by the athletic trainer, whether it's you in the clinic. That's how it is in the pros. So a lot of these high schools that have the resource of someone like yourself or the role that I'm in, these kids are getting almost like a professional level care as a 16-year-old.
Right.
Nowhere. I mean, where else in the country are you doing rehab every damn day?
Yeah.
It's a tremendous advantage for the programs that have, these providers in place when it comes to just getting kids better quicker.
Yeah. Well, I think it goes back to your point on having an end goal. If the end goal is to win a championship, then you're going to do whatever's necessary to get to that goal. And so sometimes that's pulling your ego aside, letting people go ahead of you and do other things. And I think that's something that you and I have had good relationships in the past, or good conversations with in the past on, staying in your lane, but also understanding when your time to step in, what that looks like.
Yeah.
I think that's a really good idea. And for me, it was taping. Like I was educated by one of my big mentors, Greg Dorr, on this kinesiology taping and strapping and things like that. And you and I have had a lot of good conversations this weekend about that. And I think that was my avenue. I think Brandon saw that was something that he didn't necessarily have the perfect skill for, and I was having good results. Therefore, that was our collaboration point. And then from there, we just kind of kept building and building and building. And then, the rest is history. We have a great relationship, and now the kids are getting the care that they deserve.
So maybe my second week at Memphis, we're in preseason football, and obviously, like, I have the experience as an athletic trainer taping, which I love.
Yeah.
And they have 90 kids coming in trying to get taped, and they're backing up. And the athletic trainer who was there, we had some good dialogue about my experience, but I knew my lane. Like, I was there as a chiropractic intern to take care of that sector of stuff. But they were overflowing, and we kind of like made eye contact. And I sat at the table, I set up my tape, and I was just rolling with the tape.
Yeah.
And like, I felt that rush of like, you're in game, like you're rolling. Like, that's how I explain it. You're just rolling through your task.
You're in the zone.
Yeah, like, just because you're a chiropractor doesn't mean you can't tape a bomb ankle. Doesn't mean you can't help, that one athletic trainer who has 7 sports, 8 sports that they have to take care of. You can be a resource as long as they trust you. They know that you're doing the right thing by the athlete, and you're there to help.
Yeah, yeah.
And we're fortunate enough because we have the contract at our high school. If you didn't have the contract, which a lot of times the chiropractors don't, what's your foot in the door, do you think? Like, how do you get in?
So the high school that I work at now is Tottenville High School in Staten Island. It's one of the bigger public schools. One of their coaches, his name is George Mahoney. He's the most interesting man in the world. He had an issue. He had a lumbar derangement, and he's a big, strength conditioning, working out, leading a healthy lifestyle. And he couldn't run, literally couldn't run. So he saw me. He knew I was a chiropractor. He was actually my chemistry tutor in the 6th grade. Wild, but he came to me. He's like, "Hey, I need help." Fixed him in a handful of visits. Gave him some good correctives, some DNS, some McKenzie, and I built the trust with him. He calls me a witch doctor. Mm-hmm. Are there things that we see miracles with like every day? Hell yeah! But if I could help him, the team gets into shit because they don't have an athletic trainer. Who are they going to send somebody to? Are they going to go to their PCP, then to an ortho? Then they're going to wait 2 weeks to get, into PT. It just takes too much time. Yeah. So if they have somebody who is more of a point of entry, we can get shit rolling quicker and we can get good results. That's kind of how I fit in. So obviously you want to have a good relationship with the head coaches. The athletic directors are big.
That's huge.
Yeah, you want to let them know, like, yes, everyone wants to be involved in athletics because it's sexy, but I'm not here for, the accolades of being the team physician of XYZ school. I want to make sure that these kids are healthy, confident, strong, and safe on the field. And this is how I can provide that.
Yeah.
And not everyone's receptive, but I've been lucky enough to deal with a bunch of coaches that are receptive to my the techniques that I do, the hours that I can only treat these kids, and my experience and how I triage them. Do I think they need an X-ray? Do I think they don't? Do I think I need to see them 4 days in a row? Are they going to be okay with a little bit of tape and Advil?
Yeah.
It depends. You have to just gain the trust of those who are making decisions. Most of the time, that's, the head coach or the athletic director.
Yeah.
I think too, in the high school athlete, communication with the parent is so important, so which is different than like the collegiate athlete or the professional athlete, because at the end of the day, they might not be driving. They're the one paying the bill. So you have got to communicate really well with the parents, I feel like, in the high school athlete.
Yeah. No, just from my experience with that's my bread and butter of high school athletes. And, I think that is what you said is exactly right. It's all relationship based. Like, you just have to get lucky with one of your relationships that pops you. Like, it's no different than if you're treating a professional athlete, anything like that. And so, but all you can do is just be there. Like, be there, do what you actually do. You know, like, show up. Just keep showing up, keep being there and being a resource, because so many times people say they're going to do things, but they don't actually do it. And that is a death knell for an athletic trainer, for an athletic director, for a head coach. If they trust you enough to send someone or ask you to do something, you don't do it, you lost their trust. And so building relationships is the number one ticket to getting in with high schools and getting with athletic trainers. I mean, that is 100%.
Yeah.
Because like you said, athletic trainers are overwhelmed. Like, I can just speak for Brandon. Like, yeah, he is the athletic trainer for Troy, which is a huge school. They had 180 kids out for football this year. So he's responsible for 180 kids in football, softball, soccer. So like, he is just overwhelmed. So if, as long as you're there and you're there when you say you're going to be there, you're willing to kind of, you know, do things for free, go out of your way to kind of be a resource, then like, you start building trust, and then that's where it all begins. Like,
and then I think too, when you're with a team, we've all been there, and Dr. Paulette has talked extensively about this with us. Like, it's hard to be an expert in your backyard. So like, so many times you want to just be like, you are the luckiest son of a bitch that, you know, that you're getting access to this. But I feel like, you know, they don't always appreciate you, but you got to like just kind of move on from that. And you got to just, like Taylor's saying, you got to like show up, and you got to still do a great job, eat a shit sandwich or 2 or 3 or 4.
Mm-hmm.
And then you're always better off for eating that shit sandwich, has been my experience. I mean,
I think with like going back to the parents thing, when I treat the athlete, I'll have the parents sitting right there.
Mm-hmm.
This is my impression. They'll watch me do the whole treatment session on the athlete, and most of the time, it's like, do we need to go get an MRI? I'm like, most likely not.
Mm-hmm.
If you want to, you can, depending on the where you are in the season. Depending on the severity of injury, like, how can we protect the athlete to make sure that they can play? It's okay to play with a little bit of discomfort sometimes in certain cases. But as long as you can instill a bit of confidence in that athlete that it's okay to have a little bit of discomfort, but you are safe, you are strong, you have good mobility, and the parents appreciate that. It's something that is a little bit better, because if you can win the parent, and that kid doesn't drive, like, they're going to drive them to you every damn day.
Oh, yeah. Well, and I think situational IQ, which is something that you really instilled in me, Brett, and that's one of the principles I teach on with the high school athletes. Situational IQ is very important. You brought up a point today of, what if you have medial elbow pain, but they have a state championship game next week? Like, how do you actually approach that? What's the imaging look like? What, like, do you do it? Do you risk the, you know, seeing something crazy on imaging? Do you, like, all those decisions matter, and it matters to instill confidence, but it also matters to make sure that your athlete is safe. And I think if, you know, one big principle or tenet for me with my high school athletes is early imaging, like, not being afraid to order the imaging, especially as a chiro, because now you have the primary care physician. You can order those images, you can get them. You don't have to be afraid to do that, because as Michael Shacklock says, the imaging is not the problem. It's the education off the imaging that's the problem. Meaning, if you order the imaging early before they get to the orthopedist, nothing wrong with the orthopedist. However, if there's some little defect on that imaging that shows up, obviously the ortho is going to play the safe route. But if you're the voice of reason in that case to say, yeah, you got a little labral defect, you've thrown a ball for the last 10 years of your life, like, you're going to have that. It's a normal finding. Do I think you need surgery? No. But all I know is I can change function. We can give you a really good trial of care. I'm going to put you in a safe position so that you can return to play. And if things work out, perfect. If they don't, I'm going to be there. I'm going to set you with up with the best ortho to handle this if you're not going to get better. But also, if you get better, perfect. Then, like, you don't have to have that unnecessary.
In my opinion, I want to be that guy.
Yes.
Like, I want to be the person to educate them on the image, because it's hard to unlearn. So if you were told something by an ortho or even an urgent care, like, there's a lot of kids who get hurt and they just go to urgent care. You know, not that the urgent care is bad, that they're used to treating stuffy noses and strep throat.
Saving lives, honestly.
Yeah. But most of the time that kid goes to the urgent care and they get a note that you're out for a week.
Yeah.
And it's
or they get put in a brace and on crutches.
Yeah. You can have a better, more aggressive trajectory in like your ability to return to play if we are the point man.
And anyone in sports medicine can tell you to rest. I mean, of course, that's the easy way out, honestly. It's about like pushing the limits of like, and you were kind of alluding to it before, like hurt versus harm. Like, I mean, when you're an athlete, you get to the age of like, we'll say sophomore year of high school, rarely do you step out on the athletic field and you're like, oh, you're learning to play with injuries, So I think like the education off that is critical. But like, if you're going to play in this world, like we always say, like, you do not get your reputation by telling people to rest. You get your reputation by getting people back on the field. So the easy way out is always say, well, yeah, take 3 weeks off, of course. But if the state championship is next week, like, how do you push the limits to get them back on the field without actually like harming them? And I think that's where it does get a little bit challenging for all of us, right?
Sometimes when we're on the treatment side of things and an athlete has a bit of a confidence issue, like that, like you're confident that they're going to be safe. It's like you wait for their first handoff. Like you need them to rip off a run.
Yeah.
And then they come off the field like, I'm proud of you. Like,
yes.
You don't understand what you just did. Like, you're safe, you're fast, you're agile, you're mobile.
Yeah.
And you're maybe not at 100, but you just got done what you had to get done.
Yeah.
And you just tell them, hey, like, I'm proud of you. Like, you accomplished what we needed to accomplish.
Or when you get a concussion and you don't get the CT and you see them the next day, you're just excited to see them the next day. You're just excited to like wake up and see your phone, not like, exactly.
Well, I mean, the story I have that it's still a little bit of a shocker for me is we had Troy had a really, really good basketball team. I mean, a really good basketball team. And so we had a senior that tore his ACL at the end of the season. And so trying to get him back for his senior year, they're making a run. It's 7 months. He passes everything. Like, he looks good. But then that first game back, I always make damn sure I'm at that first game. Because, oh my God, the anxiety and the fear with that, because I know the stats. Like, I know if he waits another 2 months, his risk of re-tear goes way down. However, it's his senior year. They're making a run. They end up making the Final Four. Like little things like that.
But the adrenaline rush of that situation and then seeing them succeed is second to none. That feeling is outstanding, where you just put in all this work and you see your product. You see the benefit that this athlete received, and there's no better feeling in the world of healthcare.
Yeah, no, I agree, but I think we just have to be. We're in a perfect situation to be the voice of reason in those cases.
Gatekeeper.
Yeah. Would you be better off waiting another 2 months to like rest and make sure that they're continue rehab? Absolutely. Everybody can argue that, and you can throw stones at people that return to back quicker. However, again, like, it's a senior year.
That kid may never play again.
Exactly.
In high school, it's like, my head coach in high school, every, home game, he'd be like, Rob, this is your last, December 4th ever on this field.
Yeah.
So if you have a senior who's not going to play after, as long as they're, within reason, that like they feel like sometimes they need a pair of balls too, and say like, I'm confident enough where like I can go out there and contribute and be safe. I mean, I know I'm not at 100, but I'm gonna give it my all and be there for my team. You just made that kid's like high school career.
Yeah, absolutely. And I think too, being upfront about it. Like on the case with the ACL, like I was up front with him, just like, listen, like we know the stats on you waiting another month or two, like it's going to get better. However, like I feel confident, like you've passed all these tests, you've done all these things. However, like there is still a risk. And so, just laying it out there for them and saying, it's up to you. Like I feel good I feel good, but at the end of the day, it's up to you. You've got to be comfortable with this. And as long as they are and you are, then rubber hits the road, man. And then, whatever. Can you get unlucky and something bad happen? Absolutely.
Everybody gets unlucky. No one has all cases that have 100% success rate.
Right. But sometimes, like you said, you got to lay your balls on the table and say, I feel good. Even if even if after you say that, you're like, fuck, I'm still nervous, but
but then they get in action and they do something well.
Yeah,
they score a point, or they make a great block, or they score a touchdown. You're like, that's fucking.
But everything in our world is gambling. It is. There's a 90% chance you're going to play in this basketball game today, and you're going to be fine. You might fall in that 10%, like Taylor was saying. Like, you educate everybody around you on this is just probability. So
there's a continuum of possibilities.
Yeah, always.
You have to tell the patient, even the parent, like, this is what could happen, but this is also what could happen.
Right.
And this may be something that creates memories and relationships for your child.
Yeah.
Like, this is what they've worked the past 3 years for.
But our responsibility is to buffer them against that catastrophic re-injury.
Yep.
So, that's the pressure. So you're not just snowing them into, you can play.
Right.
Yeah.
You're doing everything to hopefully create that insurance policy for them. That way they don't re-injure. But of course, that's always a possibility. And if you've educated well, then they don't look back to you and be like, you said he wasn't going to be here. They never do that. They're they're appreciative. And
it's like the hardest question, like, well, could this happen? Yeah.
Yeah. An asteroid could hit the Earth tomorrow, too.
Yeah,
Yeah, no, that's exactly right. Well, and again, I think because when you were an intern, I asked you some hard questions. We had good conversations about your experience and, the things that I was experiencing, because I didn't have that experience. I had it from my point of view, growing up in a tiny little town in Nebraska where we didn't have anything. We didn't have an athletic trainer. We had a PT that came once a month. That was it. And so, my experience was very different than what I'm providing for Troy or what you provided for the Jets, little things like that. And so I think, being that voice of reason in this field is really important. And it is liberating to have people on your side saying, sometimes you got to push the limits and you got to, you got to get out of your comfort zone a little bit.
And I think the ability to be able to make those decisions, that's why I'm starting my practice in Staten Island, because I do love the area. I like, the amount of athletes in the area. And I feel like I can be such a tremendous resource for them that isn't really available there.
Mm-hmm.
So if I can, it's almost like gatekeeping. I know I could be this for this group of people. Why the hell wouldn't I jump in full steam ahead and provide this for them?
Yeah, and I think something that you and I have in common is you're willing to do the work that maybe there's not a financial interest in right away.
100%.
And I think that is when you really, truly love what you're doing, the finances don't matter. Obviously, they matter because we need to pay our bills and we need to, do the things we want in life. However, if you're willing to, kind of blur those lines and maybe the kids that can't afford your care, you're willing to go out of your way for them. And those are some of my favorite cases. The kids that, their parents don't have health insurance or they don't have access to them. I love treating those cases because what a cool thing to say. I was there for that kid. It doesn't matter if he's going to be a D1 athlete or an NFL, whatever. To have that experience for that kid and to be there to provide that's a cool experience.
It's also a horrible thing to say, I can't help you because you can't, I can't get paid for it.
Right.
That makes you feel like shit.
Yeah.
It's if I can help you, we're going to find a way for it to work on both ends. There's so many different avenues out there to receive some degree of present, future compensation. The best thing that you could do is have the ability to get the patient on the table, to treat them, and then you just figure it out.
Yeah.
You just figure it out.
Yep.
And I'm a big believer in karma. I'm doing stuff for athletes or kids that maybe can't afford it, but it's going to come back in the future. I could put my head on the pillow at night saying, like, I did as much as I could for this kid.
Yep.
I did as much as I could for this athlete, this parent. Like, it works out.
Yeah, no, I agree. That you're 100% right. There's no better feeling than that, like going to sleep with that. So, well, let's transition a little bit. So, obviously, Rob, you're a part of a practice, and you've kind of made the decision to open your own in Staten Island. And so, number one, like, kind of what's the big excitement over opening your own practice, number one, and then maybe kind of talk about too, like the struggles of the last couple months of like figuring this all out and what that looks like in the future.
I always knew that I wanted to open my own practice. I always was confident that I could do it. Mm-hmm. There's always a little bit of self-doubt. There's financial restrictions, there's location restrictions, real estate's nuts. Yeah. You have to find the perfect storm that works best for you. So it may not be like, I want this much room to do all this stuff, but this space could work. So I'm in Jersey now, and now I'm transitioning in the near future to a location on Staten Island where this space works for me. So I found an opportunity and a location that meets everything that I need. Yeah, everyone wants to have the big 4,000 square foot facility with all the bells and whistles, but if you can find a space that works for you, what's the worst that happens? You outgrow it.
Yeah.
You find something else.
Yeah, perfect.
Yeah.
Well, I think some of that probably goes back to your athletic training background, because I know that sometimes you're in positions where you don't have the perfect setup.
No.
Like Brett and I talk about, sometimes you got to make shit work. Like at Troy, like Brandon has like big athletic training tables that are up to my chest, and so I got to figure out a way to adjust someone there. And so
I've had to tape on a chair with 3 legs. Like,
right? Yeah.
You just you get it done. Like, you prop their leg up, like you just get it done. And I think that builds respect and rapport, because like sometimes you go to a school, you don't even know what the hell you're gonna get. You don't know if there's a location, like a taping table, if you're just in a 200 square foot locker room for the whole kids and the staff. Like, you make it work. And that's like in the world of athletic training. You got to adapt. You got to be a chameleon.
Yeah.
You have to just make whatever situation you have work. And you find out how to get it done.
Yeah. Yeah. Well, I think that experience is transferring over to you starting this own practice. And, you've kind of shared with us some of your struggles and some of the difficulties with just all sorts of things, like it's not easy, but it's worth it,
My high school football coach always said, like, fear of the unknown is a tremendous thing. Like, you may be prepared, you may have your business plans, you may have your finances in order, you believe in yourself as a clinician, but you never opened up a practice before where, like, you eat what you kill.
Yeah.
So you kind of just need to have the confidence in saying, like, I did the best I could to prepare. We're going to do it. I have resources in play that believe in me, that I could lean on. You support the people that have supported you, and you jump in, and you have a good result, hopefully.
Yeah. Oh, yeah.
You'll be fine.
You will. No, I think that your experiences in the past have led you to this point, and I think that's an exciting adventure for you. And like, what's the overarching vision of your practice? Obviously, you're coming into this in Staten Island with your ATC background, your high school background, stuff like that. But like, let's just say 15 years from now, we come back and we re-interview Rob. Like, what would be a success? Like, what do you really envision this practice to be, and what do you want it to be?
My biggest thing in like our world, which also leads into athletic training, is efficiency. You want to be as efficient as possible. So I wanted to open up a practice where I could be as efficient as possible and provide a resource to athletes, active individuals, general population that's a bit different than the mechanistic conveyor belt line of other places. Right. I do think that building a rapport with a patient takes more than 8 minutes.
Yeah.
So if you can be with a patient and really have buy-in and understand that this is what they need, this is how long it's going to take, and guess what? This is like, we could do this, this, and this. You're available. And I think in my area specifically, there's not a lot of integration with efficiency in what we believe is the best treatment for the active individual.
Yeah, I love it. Love it. No, I think just being a resource, that's my why in life.
Yeah.
I think like that's why I really feel like I'm on this planet, is to be a resource with my patients and the people around you. And I think that you would reflect that same thing. And it doesn't matter if it's your athlete or, you know, your grandma down the street or whatever it might be, like being a resource for those patients and getting them in the right position in the health.
Sometimes they don't know, like the athletes, the parents, the coaches, like they don't know what is available to them. You know, and in order for me to explain what I believe the patient needs, I need to be available.
Yeah.
So that's why we're moving to Staten Island, so I could be a resource for, you know, the community that I grew up in, and kind of give them that professional level of care at a high school athlete. Like these kids are potentially going to go and play at the next level, and they're going to know, like, hey, when I worked with Dr. Rob, we did this, this, and this. Like there was a plan. This is, you know, where we spent a lot of time. We didn't emphasize a lot of this, like depending on your treatment, but like at least maybe in the future, they'll know what to look for. They may not waste their time. They might not waste their money. It's just being available and being a resource for people who don't know what you can provide. A lot of people still don't even know that, like as a chiropractor, like you could treat a damn ankle.
Right.
Like I could treat a knee. Like there's so many people who just don't know the scope of what we can benefit. And that's like the biggest thing. Like I want people to know that like I can handle this. And if I can't, I'm going to get you to who can. And we're not going to waste time.
Yeah. Yeah. No, I think that's exactly right. I mean, at the end of the day, our high school parents, they, especially now more than ever, they want their kids to play. They want to do whatever needs to happen. But a lot of times, like Brett and I, we talk about that all the time. Like sometimes they feel like their primary care physician has better contacts than we do. And the reality is that's just not the case. You know, like so many times you get stuck into a hospital system or into a healthcare system where you have to just stay in that system. Whereas with us being on the outside, like we're able to order the right imaging and get them to the right person and, you know, dictate that imaging saying, no, this is my problem to deal with, or this is someone else's problem to deal with. And so being that resource and being there for them in those situations, I think is like the best thing that we can ever do for our athletes.
When you can explain, hey, you just saved yourself 6 steps by coming to me first.
Right.
It's like, holy shit.
Yeah, yeah.
Like, I didn't have to go to the PCP. I didn't have to go to the imaging center. I didn't have to go back to the ortho.
Right.
And for the record, they won't realize everything you're doing for them. Just so you know. Yeah.
But at least I could try.
Yeah. You got to do
try.
it. You do it. Yeah.
And that's something that I try to, portray to the coaches is like, you know, if your kid needs imaging, I will order the imaging. I will make damn sure they get the right imaging. And so being able to be there and just, you know, whatever. Yeah, I'm probably going to take a bath on that first visit. If they need imaging, whatever. Like they get that first visit for free. That's fine. And if they need to go to surgery, I'm not going to make any money on that. However, like I'm going to do good on the back end because I did right by that athlete and I did right by that coach and I did right by that parent. And I think that that's something that's maybe a little bit lost in the whole manual therapy realm, is like there's not always a perfect opportunity to get paid for those situations, but there is long term, because that's where marketing comes into play. Like that was a good marketing opportunity for you by getting them to the right person, and then on the back end there's trust, there's, you know, there'll be money eventually. So yeah.
Hell yeah.
Yeah. So, well, anyway, Rob, obviously you're literally one of our favorite humans. That's why you're
I
here this
appreciate
weekend.
you guys more than you know.
No. Yeah. So, anyway, guys, I hope this is good, insightful information on, not only just like the whole ATC Cairo, continuum. I personally wish I would have went down the ATC route just to have that in my name. Does it change anything? Probably not, but I still think that would have been a huge addition to my credentials and just my background.
You're doing okay.
Thanks, Rob. Well, because of you, that's why. But anyway, guys, we'll. I can't wait for a year from now. We'll revisit this with Rob and kind of see how the practice is going and see the struggles and all that kind of thing with him. And but anyway, we're really proud of you. Obviously, Brett, I know that you're very proud of the intern program, the interns that we've had. You know, even before myself have gone on to do great things, and Rob is obviously one of those people that we really expected to go on to do great things.
No, I mean, it's like we hung out the last 3 or 4 days, and I guess because I'm so old, it's like when you see like your former students go on to do great things, like to me, that's like the best feeling like someone in my shoes can have, you know, like when you just see these people like become these like leaders in our profession. It's like, it's so crazy because you feel like, I don't know, like in my shoes, I always feel like I need to like almost like overreach and then you're like, well, shit, Rob's doing this without us. Like it's
Yeah.
And that's like such an amazing feeling to like see like, you know, and we do feel like the interns that come through, they go on and they do crazy, amazing shit, you know, like, and we look at our list of interns, we're like, my God, look at these people and what they're doing now. And I mean, it's like the thing that keeps us going, honestly, you know, because these are long days in practice. And so when you see someone like yourself doing what you're doing, it's like the best feeling ever, honestly. So.
It's a nice confidence boost. Like, I look up to you guys as, you know, mentors and peers, and having confidence builds confidence in myself. Like, knowing that you understand that I could get it done makes me think like it's gonna be completely fine.
Dude,
There's always afraid of the unknown.
Yeah.
But if you have the backing of people that you trust,
it's gambling.
what's the worst that could happen?
Yeah, no, it's just gambling.
What's the worst that could happen?
Yeah, absolutely.
Like an old banker used to tell me, if you can't bet on yourself, then you're
Jump in.
Yeah,
If you want to, if you're an associate and you're like, hey, I want to open my own practice, like, what's the worst that could happen?
Don't waste the time. Just do it.
Create an environment that allows you to succeed, and you're going to be fine.
Yeah, I agree. Yeah, and for any students listening, if you're interested in the intern program, I mean, even from when Rob was here, we've progressed it every single year. We progress it. So if you're interested in applying, go to gestaltedu.com/internship. And there's a Google form that you can fill out to apply, and then just reach out to us. But yeah, Rob, I love you, man. I thank you for instilling some confidence in myself, like with the sideline stuff and in the things that I've been doing, and making me feel heard. And, you know, when you were there, you were on the sideline with us and kind of walking me through things and watching me do things, and you gave me good feedback and gave me some advice. And so I really appreciate that. But yeah, as always, guys, we love you. We want you to have just unbelievable clinical success. And Rob's one of those guys that we're fully behind, and we want you guys to have the same success. So keep progressing, keep learning, keep going to seminars, keep reaching out to us, doing all these things, and the next thing you know, you're gonna have a great career and super fulfilled. So,
and do it for the right reason.
Yeah.
Don't be an asshole.
Don't be a dick.
Don't be a dick. Rule number one: don't
Just
be a dick.
Be a good person.
Be a good human. That's
You'll
right.
be all right.
That's right. All right, guys. Well, as always, we appreciate you, and good luck with patients. We'll see you next time. I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.